February is American Heart Health Month, with heart disease being the leading cause of death worldwide. But this year brings an additional risk because of COVID-19 concerns. Now, one man tells me about his close to death experience and why the pandemic shouldn't make you hesitate to seek medical help.
I didn't feel terrible, or I would even say I didn't feel bad, but I just had a little bit of pain in my chest.
Back in April of 2020, Pat Perry, a lawyer in Warren, woke with some chest pain and decided it was heartburn. He hesitated to go to the hospital because he was worried he'd contract COVID-19.
We decided to take a wait-and-see attitude, and if anything got worse, that we would go to the hospital.
Later that day, Perry suffered a massive heart attack. His wife, Melissa, finding him hours later.
We could have avoided maybe it becoming a massive heart attack. It could have been something that could have been treated. The damage to his heart is permanent, and it was a bad decision that kind of changed everything.
But Perry is not alone. A new Cleveland Clinic survey shows that nearly half of Americans avoided medical care after experiencing concerning health issues because of the pandemic. Perry calls himself lucky to still be in the lives of his wife and young daughters, but wants to remind the community that your health should always come first, even through a pandemic.
If you even have the slightest hint that you might be in the middle of a medical emergency, then do not even consider COVID as a factor in the decision to go seek treatment.
Perry beat the odds with a 14% survival rate, but suffers permanent heart damage. Now he hopes others can learn from his mistake.